Hi guys, so this is day 7 after my surgery, which means that I'm going to the clinic this morning to remove off my cast and take off my stitches. Last night, again, in terms of sleeping, was fine. I've actually kind of got used to sleeping on my back, and it did actually feel really comfortable yesterday, which is strange because I used to hate sleeping on my back. Yeah, but it's something that you really kind of get used to really quickly. So when my cast comes off, I'll hopefully just do another video just to show you guys the shape of it. But I know it's not going to be, the kind of the 100% final nose shape. There's still going to be a bit of swelling, and 90% of the swelling goes down within the first 4 to 6 weeks. So there's still going to be a bit of, basically my nose is still going to be swollen just a little bit, but you won't really be able to notice it that much. And then the remaining 10% takes around, I think, up to a year to kind of completely go. But again, you won't really be able to notice it being swollen that much. My left nostril has kind of stayed open now for about 2 days, which is really good because yeah, I used to have both my nostrils kind of blocked 24/7 or partially blocked, which was quite annoying. But I can kind of breathe clearly through my left nose, which is great. And the nasal drops are really helping. I feel it's kind of making making all that blocked nose turn into kind of mucus, and then comes down, and then I just have to kind of wipe it up. My right nostril is partially blocked, but I think this is the best I've kind of ever been in terms of breathing, which is quite quite remarkable, considering that I've only had my surgery done a week ago today. As you can hear, it still sounds like I've got a little bit of a cold. That's, I think, because of the right nostril kind of being partially blocked. But yeah, so this is day 7. Hi guys, so I've just taken my cast and stitches off at the surgery, and as you can see now, it's quite clean. Actually, very clean. I used to have a bit of like kind of debris just there, and also inside my nose. And in terms of the shape, it's really good. Of course, you can see it's still quite swollen. But again, it will take about 6 weeks for most of it to go down. But in terms of the shape, I'm really happy with the shape. You can see it's just straight. Before, I used to have a little kind of just little bump there, so that's great. And in terms of Dr. Silva actually cleaning my nose, I did have a bad reaction to it. Kind of 1 in 10 people feel quite dizzy and like they're gonna faint and start sweating a lot, and that's exactly what happened. It wasn't that great. It wasn't that great of a feeling, but it only lasted for about 5 to 10 minutes, and I just sat down, drank some water. I did feel like I was gonna kind of throw up, but thankfully I didn't. And yeah, again, it just passed in about 5 or 10 minutes, so it wasn't that bad. And it was an injection to improve the swelling. So it's definitely something that I kind of had to do, and I have to go back in 6 weeks time to do it again, which I'm not really looking forward to. But if it improves the swelling, then yeah, I kind of have to do it. But again, really happy with my nose shape, and this is really nowhere near what it's gonna look like, say, in about 4 to 6 months time. And I'm really happy with the results right now. So I think every single day, every week, and every month it will get a lot better. So yeah.